Hello friends, this is Dr. Abdul Mubin A. Mundewadi from Mundewadi Ayurvedic Clinic. In today's video, we will discuss the Ayurvedic herbal treatment of hearing loss. Now, hearing loss can be of three types: sensorineural, which results from a dysfunction of the auditory nerve leading up to the hearing center in the brain. The second type is conductive, which results from a dysfunction of the middle ear. And the third type is mixed, means it is sensorineural and conductive as well. And this includes both these types, sensorineural and conductive hearing loss. Now, this medical condition may be related to various causes such as infections, trauma, medications, misuse, or occupational overexposure to loud sounds. Now, overexposure to this loud sounds exposure can lead to sudden hearing loss, whereas the other causes usually result in a gradual loss of hearing. The modern system of medicine cannot provide any effective medication for such types of hearing losses. The only option is surgical correction and the provision of hearing aids. Now, hearing aids can give limited benefit to most people, whereas the surgical correction, cochlear implant can give good results, but it is prohibitively costly. Now, sensorineural hearing loss can usually be treated completely with the help of Ayurvedic medicines. Treatment is usually given about 6 to 8 months depending upon the severity and presentation of each individual case. Associated symptoms like diabetes, blood pressure, buzzing sound in the ear and discharge from the ear can complicate the symptoms and may require additional medications. Individuals affected with this condition who do not have discharge from the ear are also advised to use local ear drops. And in addition, you can give local steam fomentation. Plus, Shirobasti or Shirodhara can also help with the treatment. Now, most patients report improvement in hearing within the first 2 months of treatment, and overall there is an improvement in hearing of about 80 to 90% on completion of treatment. Of course, the patients need to remove the cause needs to be treated or removed, and medicines need to be taken regularly. And if there is a combination of oral treatment and panchakarma, for as I said, nasal medication, nasa treatment, and steam fomentation, and possibly Shirodhara, then the results are quite good. Now, conductive hearing loss is usually related to an ossification of the tiny bones which connect the eardrum to the auditory nerve and therefore conduct sound impulses from inside to the inner ear. The response to Ayurvedic treatment for conductive hearing loss is mixed. About 50% of patients improve very well with the first 2 months of treatment, while the remaining 50% may report a gradual improvement in hearing. Now, such patients can possibly go in for surgical correction or continue treatment for a longer time. Usually, most patients of conductive hearing loss, if they take the treatment for the full required time, then they can carry on their normal lives after taking a full course of 6 to 8 months of treatment. Individuals with mixed hearing loss are treated on a case-to-case basis depending upon the individual presentation and severity of symptoms. However, most of these patients do require treatment since there is a sensorineural component to the hearing loss, and this hearing loss goes on increasing with time. So it is better to start treatment as early as possible. Majority of the patients report an improvement of hearing from nearly 40 to 70%, even if the hearing loss is mixed, because there is a sensorineural part of it which can be treated quite well. So all in all, Ayurvedic treatment is very useful in the management of this condition. So friends, this is a short description of Ayurvedic herbal treatment for hearing loss. Let's meet in the next video. Goodbye.